And go.
Okay, my name is Cheyenne and I wrote my paper on diseases and hygiene in developing nations. The third world countries have many problems with disease and hygiene that need to be solved. Many developing countries experience more deaths and illnesses due to the lack of proper sanitation and hygiene habits every year. Most health issues stem from problems such as unsafe water, urban air pollution, lead exposure, and unintentional poisonings. Also, many people are exposed to harmful toxins that are emitted into the soil, air, and water by the industrial factories. All these toxic exposures and unsafe sanitation habits lead to chronic health conditions and diseases including malaria, acute poisonings, diarrheal, and respiratory diseases, and also MRSA. My main argument is that the lack of proper health and hygiene habits are one of the largest leading problems in the developing countries like Africa and Asia. My first topic is malaria. So disease is one of the leading causes of the third world. And in India and in Indonesia, one of the most threatening and impactful diseases is malaria. According to the CDC, the Center for Disease Control, the Southeastern Asia region is responsible for approximately 1.2 billion people being exposed to the risk of malaria, and most of those people live in India. The recent spreads of malaria are killing 100 times more people than Ebola. In 2010, an estimated 91% of deaths in the African regions were due to malaria, and the most vulnerable to the disease includes children and pregnant women because they have little or no immunity. The disease is mostly transmitted through bites of infected mosquitoes, but can also be transmitted from a mother to her unborn child, and also by blood transfusions. And these symptoms of malaria include fever, headaches, chills, and vomiting. And if it's left untreated, it can lead to death. The disease thrives in the more temperate climates such as India and Indonesia, which results in these countries being ridden with disease. Malaria is becoming drug resistant and causing large epidemics in India and Africa. These countries are trying to decrease the epidemics through vector control and by using insecticide-treated mosquito nets and spraying their homes with residual insecticides. My second point is hygiene. Hygiene and the practice of proper sanitation have been rather large problems in India and Africa. People of India have been defecating in the open and have not yet established proper sewage systems, and they do not own toilets. With India's large population continuously growing, it makes it almost impossible to keep the areas clean and clear of feces. India suffers greatly from diarrheal diseases due to their lack of proper sanitation, and many people are drinking water that is contaminated with fecal matter and parasites, which contributes to the risk of the diarrheal diseases. The human feces contaminates the crops, well water, food, and it also stays on the children's hands because they do not practice proper hand washing techniques. By not washing their hands, they are leaving all the harmful bacteria on their hands, and they will eventually touch other people, food, and possibly their mouths, causing the harmful bacteria to spread and to be ingested. Ingesting these harmful bacteria lead to chronic illnesses like encephalitis, which is a disease that causes inflammation in the brain due to infection, and it also causes waterborne diseases. These waterborne diseases include diarrhea and respiratory infections, which are one of the leading causes for child deaths in India. The diarrheal causes cause the children to become weak, malnutrition, and also make them vulnerable to other serious infections such as pneumonia. My final point is pesticide poisoning. According to pesticide prevention, India experiences routine deaths every year due to acute pesticide poisoning. They also experience many health complications because of the high lead exposures. While working in the mines, Indians are being exposed to some of the highest lead levels in the world. And breathing in the dust of the lead can lead to severe respiratory and blood diseases, and also may lead to death if untreated or if they have been exposed for too much time. In India and Nigeria, the people working on farms and working other agricultural jobs are exposed to harmful pesticides that are banned in these other countries. In the United States, these pesticides have been banned because of their harmful toxins and the effects that they have on humans, but India has yet to ban these harmful products that their people use every day. Many children are dying because they are ingesting food that is tainted with the pesticides. One of the harmful pesticides is called organophosphates, which is used to ward off agricultural pests, but it is also very toxic and achieves the same effects as a nerve gas. Pesticides like these are being ingested and killing the people and children of the developing nations. Pesticide poisoning is causing many deaths that could have been prevented if they had the funding for safer agricultural pesticides. In conclusion, multiple diseases and lack of proper health and hygiene skills are some of the largest leading problems in the developing nations like Africa and Asia. These problems have become large hindrances on the countries and have impeded their development. Overall, the developing nations are facing true problems, and most of them stem from lack of hygiene and disease. If better practices are enforced for hygiene and the treatments for disease are better reinforced, then the developing nations of Africa and Asia will be able to improve their countries with less obstacles overcome.
Good. Now, it's not related to the points, I'm talking about the present. When we go to the international conference, continuous reading they don't like, because they give only 50 minutes time, we have